So, it looks like the definition is changing now. It is a neurological disease. It is caused by an insult to the brain done by chemicals who are defined by their capacity to release dopamine. They make you feel pleasure, but you also memorizing them and giving them saliency or preference over any previous behavior that used to be satisfying for you. So now we have that the brain, after you expose yourself to drugs long enough, will change his priority toward the use of drugs, recovering from drugs, or pursuing the way to get the drugs at the expenses of your previous usual behavior. So if I develop an addiction to a particular drug, I'm going to eliminate little by little all my priorities from taking care of my kids, working, relating with my friends, being around people. And all I'm going to do is focus myself on using, abusing, and doing whatever I have to do to get drugs. But this is not a voluntary phenomenon coming from the prefrontal cortex. This is coming from deep within the brain in what we call, in general, the primitive brain. If my primitive brain wants me to be alive, he's going to make me do the things needed to be alive. The primitive brain is blind, doesn't smell, doesn't see, doesn't follow rules, doesn't care about consequences. If that primitive brain is told that his job is to make me do things so that I can release dopamine and feel pleasure, the primitive brain is going to be hijacked into believing that drugs is the most important thing to do for that human being. And he will use all his tricks to make me use drugs or increase the abuse of drugs when the tolerance develops. So after I use drugs for a couple of days, I start making some memories. They're not that strong, but they are going to go, here it is, to my frontal lobe. And they're going to tell me, go for a couple of beers. And I voluntarily will say, nah, I don't want to drink. There is no disease of addiction. But if I keep drinking, this signal is going to get signal from this other part of the brain, and this part of the brain, and this part of the brain. And now I'm not going to get a weak signal. I'm going to get a very powerful signal from my brain telling me to use drugs. The prefrontal cortex make a judgment, an action. This is what makes us human. Without prefrontal cortex, we probably will not have an addiction. But prefrontal cortex is what makes us human, intelligent, and what we are right now. So most of the time, these signals are not strong enough to make me substitute a social behavior for drugs. And you tell me, let's go and get drunk. And I say, no, I don't want to get drunk. So I probably have a use or abuse, but I don't have the addiction. So when these forces coming from within the brain bombard the prefrontal cortex to a point that the prefrontal cortex cannot say no, the patient automatically will go and use. If he was sober, he's going to relapse. So when these forces coming from deep within the brain and take over a weak prefrontal cortex, basically the person will automatically relapse. Do they know what's going on? No. What will they usually tell you? I don't know. I couldn't help it. And the point is that it's not a voluntary disease. It's involuntary. It is deep within the brain. And it has to do with the essence of being human. Let's destroy this thing in humans, and that's it. Well, we cannot destroy that little tiny area. If we do it, we will not be motivated to do nothing in life. We will sit in a chair and do nothing. The closest to that is Parkinson's disease. You heard about Parkinson's disease? Parkinson's disease is treated with dopamine drugs, but eventually the dopamine system dies. You sit then in a chair, they will stay 24 hours sitting there. They will not ask for anything. They will not do nothing. So we cannot touch that area of the brain, because by doing so, we basically will stop being human. So the reason we do certain things, I like to go this way. I don't like to go this way. I'm not making the decision. Memories from me going that way or this way are in my brain. And they will fight with each other. If he goes this way, I'm going to give him some dopamine. If he goes this way, I'm going to make him punish and lower the dopamine. So the brain basically tells me what way to go. So if you like something, it's because you associate that with pleasure. If you don't like something, it's because your brain didn't. So I'm going to resolve a big conflict in couples. That is a big problem. The husband wants the wife to do X, and the wife wants the husband to do Y. And they're in conflict. So I like to watch animal programs. My wife hates it. She likes to watch detective programs. Boring. Basically, my brain releases dopamine when I do what I do, but I don't release dopamine when I do what she does. And the opposite for her. So even that behavior is now basically my preference, is the way my brain ends up wiring and memorizing those events. So when a person develops changes in the brain circuitry in which drugs become the most important motivation for life, that person will have the disease of addiction. And because of that, his life is not going to be in control. Even if he says, I'm not going to do it, this is the boss. And this will make you do it. Now, when we look at a person who is abusing substances, all these changes will modify that brain, because high level of dopamine, physiologically, the way the brain functions, is clearly telling the brain something is wrong. So the brain will decrease the potency of this circuitry and try to weaken the stimulation in the nucleus accumbens. And the brain uses different ways to do that. So if I get high and my dopamine goes to 400, and I do it again, and again, and again, eventually my brain is not going to give me 400 units of dopamine. It's going to lower the dopamine release. So I'm going to need more drug to keep the same level of pleasure. That's tolerance. Now the brain resets itself. So if to be normal, you need 100 units of dopamine. If you do the right thing based on your culture, you'll be fine. But if you develop the disease of addiction, you reset your brain to 300, not 100 dopamine. When you stop doing drugs, it's going to go from 300 to 100, and you are not going to feel well. You're going to develop a negative emotional state. Your life will be miserable. You will not enjoy things the way people normally do. You will not be motivated to do much. Your brain now says, I want 300, not 100, because those are the changes needed so you don't die. As a consequence of that, what follows addiction is a state of low energy, low motivation, low desire to accomplish things in life, which we now call negative emotional state. You guys call that depression. And you want to get medication for that, thinking that an antidepressant can fix this mess created by drugs. And of course, interesting enough, it does the opposite. It messes up your brain. Addiction relapse, patients feel guilty, family pressure the patient doesn't know what's going on, the doctor is telling him, I'm doing my best. I don't know why you relapse after you were doing better. And patients go back to square zero. So basically, the treatment of persons with addiction require that we basically put him back in the normal environment that allow no drugs to be used. And our fantasy was that by doing that, this will rewire back to normal. It's not happening, and it looks like it will never. Once an addict, always an addict. It's true. It's proven. So the idea is that these changes are, so far, irreversible, permanent, and I'm going to simplify the way one of the experts in animal studies of addiction, I asked him, give me one phrase, what is addiction? He said, addiction is a neurological insult caused by drugs that the patient have to learn to live with. I says, okay, can we undo it? No. What's the best way to focus into the addiction? Prevention. We need to educate that if you go that route and you don't stop it when it is stoppable, you will end up developing a permanent damage in your brain, and you have to learn to live with it. It's exactly like me stabbing myself with something in the head, end up with some deficit in my body, and now I want them to fix that and to give me a pill to fix that problem. Neurologist is going to look at you and says, you're going to go to over rehab and learn to walk again, and you have to learn to live with that. So it is a chronic exposure to drugs cause a neurological damage that the brain has to adapt to, but it will not make you go back to where you were before you were at that level. We have 10 people using alcohol for 3 weeks, and then we tell them don't use more alcohol. Probably one of them will continue using alcohol until he learned to be an addict. I like to use that phrase. You learn to be an addict by exposing yourself to the insults from the drugs long enough until you change your brain. When the brain changes, the rule will be relapse, misery, struggling in a chronic way.